Good morning, Bob Ravenscroft here for this Thursday's press briefing. Good to be back here. Hopefully this once-a-week schedule is working for you along with the other updates that we send out to the media. Midnight census, we were at 474 patients here at Bryan, and the COVID numbers continued to decrease, which is such a welcome release. Right now, we have about what we would say 34 COVID patients in-house. 24 of them are actively positive, and then 10 of them are still hospitalized, but they are no longer infectious. Level of care, you can see, continues to drop. Of these patients, only 6 are in our ICUs, and 4 of them are on ventilators at this point in time. When you look at where our patients are coming from, almost a 50-50 split. 18 are from Lancaster County, and then 16 are scattered, as you can see on the map. So again, we think that it's a couple of things working. There's been more people that have had COVID. There are vaccinations going into people, and there has been certainly increased adherence to wearing a mask, which is all contributing to that. There was some recent news, I think, that you saw about double masking and the effectiveness of that. I think that's fantastic. It's heartening to us because that's the same thing that, not necessarily double masking, but the universal mask wearing has proven very effective here at Bryan since April, and it's just great to see that. So basically what it was, the CDC has come out with some recommendations that if you double mask, it can be up to 95% effective from both receiving and transmitting, and it's all about the tightness of fitting and that extra level of barrier. So I would encourage anyone interested to go to the CDC website to get the latest on that, but supports what we have been sharing for a long time. Please continue to wear these. The better the fit, the better. Universal masking, highly effective. A little bit about vaccinations, because we are in the season of vaccinations, and I think we all understand that. Bryan has now administered just shy of 8,700 doses. 8,697 doses have been administered at Bryan to the groups identified for us to take care of, and that includes both first and second doses. We do continue to receive vaccination supplies. I just want to reiterate that they are not ours. They are the health department's. Lancaster County Health Department has relied on us for storing vaccine vials, and we're continuing to do that. I don't have the specific account that we currently have, not that would be of great interest, but the inflow of vaccines, I'd say, is slowly increasing, which is a great sign, just from a side conversation I had with someone in our pharmacy that deals with the storage of them. We are continuing to support the mass vaccination clinics at Pinnacle Bank Arena with both clinical and support staff. I can tell you it has been an incredibly uplifting experience for all participants. Personally, I'm looking forward to doing mine next Friday, and so forth. So we continue to do that. One other bit of information, there are going to be a couple of mini clinics coming up in the coming days. The Lincoln Lancaster County Health Department asked for our help in that, and what this is going to be is for some high-risk patient populations that won't be asked to go to Pinnacle Bank Arena. The notification of who is eligible for these mini clinics is not happening from Bryan. It's from the identified physician practices who are contacting those patients. However, we will conduct some of these clinics at Bryan because these patients are familiar with coming to Bryan for their care, and we've proven we can do them very efficiently and safely. We are not going to be providing photographs or video of any of these clinics, nor inviting the media to cover them, because of the nature of how the health department is doing it with identified physician practices for this extremely high-risk patient population. You begin to skirt the edges of their protected health information. So I just apologize in advance. We won't be supplying photos or video of that. But I think the good news is the supply is loosening up some, allowing the health department to continue to accelerate their public vaccination, and then also helping us with, or asking for our help with the identified physician practices and their high-risk patients. universal masking has proven highly effective. However, I think it's awesome news that the 2 layers provide an extra measure of protection and comfort. So again, go to the CDC website. They recommend, a surgical mask like this covered by a cloth mask is really, really, really effective. Days are taking place. It'll be the first one this weekend, Matt. I don't think the age is as big of a deal. It's more on the medical conditions. As far as the official count, I'm not sure. We will get that from the health department and the practices as they've reached the patients that fit that profile. So it's, I'm guessing they'll skew older, but it is primarily driven by medical conditions. I think the things they're looking at are respiratory, renal, and hematology and oncology patients. Not certain. I would encourage you to direct those questions to the Lincoln Lancaster County Health Department. We're thrilled we can help in getting more people vaccinated in any way, shape, or form, though.